Most people who work in healthcare are here in healthcare because they want to do good for patients. And I think by telling patients stories really reminds staff of why they're really here.
No better care than the VA. When I got here, I felt wanted. I didn't have any pressure on me, and the nurses were around the clock, always making sure that I was taken care of all the time.
These counselors and these staff members, they truly do care. And if you sit down and explain to them what's really bothering you, they'll listen, they'll get you the help. They have the solutions to your problems.
I've been with the VA for 30 and a half years, so I've dedicated my whole entire career to the VA. I was a medical student here, a medical resident here. I love the VA. I love my patients. I treat them like my family.
Having staff remember that they can make a difference by smiling, by a warm welcome, by a warm send-off, by advocating for a patient, going the extra mile to advocate for them, remembering the small things like noise and food and maybe offering to call the chaplain for them. Every employee realizes that they can be patient-centered in very simple ways.
When this suite was designed, first and foremost on our minds was trying to create an environment which catered to patient privacy. Patients love coming here. As you can see, it's a very luxuriously appointed room. They love the patient privacy, and they love the warm environment. They love the soothing wall murals, and they love the kind of very personalized care that they get. There's no feeling of they're just a number. They get really very personalized care and in a very comfortable environment, a very private environment.
Having the focus on patient-centered care really allows you to be humanistic and to realize that this is another human being you're taking care of and to relate to them. So not only are you helping demystify this healthcare system for these patients, these veterans, you also are finding healing because you relate to them as a human being and you yourself get satisfaction from what you're doing because you're dealing with the whole individual, you're dealing with their caregivers and helping them be empowered. And then you have your staff rallying around you to provide you that support.
If it wasn't for the acupuncture program that the VA is offering, I would be on medication, my quality of life would be greatly diminished, and the side effects of the medication would be affecting me by now.
Personally, I'm a breast cancer patient. I'm a 2-year survivor as of April. To me, it's very personal, and I'm very proud of what we can offer women here.
Every individual in this country who's put on the uniform and bore the stress of being a military person, serving their country, they deserve everything that we can give them to bring them back to their wholeness and their wellness again.
For staff that are just starting their journey in the VA, they can use the model for the proactive components for personalized proactive health. If we were to look at that wheel and start with practices such as the importance of sleep, the importance of wellness, the importance of spirituality, surroundings, healing environments, interactions between staff and patients.
Well, we want you to be physically well. We want to be able to help you in the other aspects of your life, emotionally and spiritually. And so if we can find an easy tool, like giving you a cell phone, and that helps you with that, and to me that seems like a no-brainer.
I haven't been in communication with them for at least 5 years as far as the telephone is concerned. And when I got the telephone, when the first person I called was my 2 daughters, and let them know that I had a telephone. Now we can communicate now, you know, and make up for lost times.
The way our Patient-Centered Care Steering Committee is designed is that it's around the components of patient-centered care. What's key about the steering committee is the interdisciplinary staff. We have staff that represent unions. We have staff that represent the front line. We have leadership teams. We have veterans. We capture all of the perspectives at this one committee and focus on these proactive components that are very important to veterans.
The care we provide here is transformative. We seek to really listen to our patients, listen to their needs, listen to their concerns, and then empower frontline staff. Take those ideas, take what they hear from patients, and do something with that information.
Realizing how we made a difference in somebody's life. not just a little difference, a major difference.